Hi everybody, and thank you Helen, and thank you to the N8 for both funding this work but also for hosting the webinar today, and thank you all very much for coming also. It's great to see so many of you here. So I'm Charlotte, so I'm Dr. Charlotte Barlow, and I'm a reader in criminal justice and policing at the University of Central Lancashire. And also here, but I'm going to introduce Sandra just for flow purposes, is also Professor Sandra Walklate, who is Eleanor Rathbone Chair of Sociology at the University of Liverpool. And so we're here today presenting on a research project that we've been working on for the past just over a year, which is exploring who is the victim, identifying victims and perpetrators in coercive control cases. Okay, so in terms of the purpose of the presentation today, we're going to explore and introduce some of the implications and findings of some of the research projects that we're here to discuss. And just as a note, Sandra and I have been working on various projects exploring coercive control, and in particular police and other agency responses to that, really since 2016 onwards, so both together and separately. But this project is our most recent in this body of work, and it's focused specifically on that moment of identifying potential victims and perpetrators, and identifying the sort of primary perpetrator during the police response that is the focus of the work today. And so we worked with a partner police force on this project, and as noted, it was funded by the N8. We'd also like to extend our thanks to Emma Finnegan from Northumbria University, who was the research associate on this project. So sincere thanks to Emma for all of your work on this project, and also on the development of the report as well. And you can download the final reports by using this QR code here. We're very fancy with the QR code, but you can also find the reports on the N8 project website as well. We'd also like to at this point to extend our sincere thanks to the partner force and also the domestic abuse organisations that we worked with in the development of this project, who have been fantastic to work with throughout the process. So thank you very much. Okay, so a little bit more detail then about this study. So the project that we're going to be talking about today involved 4 core methodological stages. So the first was a quantitative analysis, where we looked at our partner forces domestic abuse data from the period of 2019 to 2022. And then we did a deep dive analysis of coercive control cases during that period. And then we conducted interviews with victim survivors about their experiences of the police response to coercive control, in particular that moment around that identification process. And then we also conducted interviews with police officers of varying role and rank, and also varying engagement with domestic abuse as part of their work as well. So this sort of 4-stage approach to our sort of methods meant that we could contextualise the qualitative data with the quantitative findings to provide that sort of bigger picture understanding. And it also meant, because as I mentioned at the beginning, Sandra and I have sort of been working on projects exploring police responses to coercive control since 2016, we're able to have this sort of look at that national picture in terms of data over that time period as well, which has been really helpful for comparison. It's also important to note that although we obviously worked with the partner forces and domestic abuse organisations, which, as I mentioned, we're incredibly grateful, the findings that are presented here are our responsibility and based on our analysis. So just to note that at the beginning here. Before sort of providing the sort of context for the presentation and the sort of focus of that identification moment, I just wanted to spend a moment looking at that quantitative data so that we have a sort of clearer picture and understanding of the partner force that we work with in terms of understanding the landscape and data in relation to coercive control. So over that sort of 3-year, 9-month period, we can see from the slide here that there was an increase in recorded levels of coercive control over that time period. So in 2019, there was 647 cases, and then by 2021, there was 811 cases. And that really mirrors the national picture that we are seeing increases in recorded crimes of coercive control. And we can also see there on the slide that out of the around 2,320 coercive control cases that occurred over that 3.5-year period, 306 of those led to an arrest. And we can also see that coercive control is more likely to be recorded as the primary offence in cases where there was an arrest and also where there was not an arrest as well. And the most common secondary offences that were recorded were harassment, criminal damage and assault without injury. We can also see, again, mirroring that national picture, that this is a highly gendered crime with victim survivors overwhelmingly being female and perpetrators being overwhelmingly male, which again mirrors the national picture and also the work that we've conducted previously with other police forces as well. We can also see in terms of looking at the risk assessment data that most commonly coercive control cases were dash risk assessed as medium risk, equating to around 40%, and then around 30% of cases were risk assessed as high and around 30% of cases risk assessed as standard. Looking at the outcomes of particular relevance to the study and what we're going to go on to discuss are outcomes which relate to outcome 15, which is where a victim does support but there isn't enough evidence to carry a case forward, or outcome 16, which is where the victim survivor doesn't support further police action. And so we can see when an arrest did take place, outcome 15, that not enough evidence was more likely to be recorded as the outcome, and where an arrest didn't take place, it was more likely to be outcome 16, where the victim survivor didn't support further action. So this is just to kind of give the context and also to highlight that in many ways this is sort of supportive and complements the national picture in relation to policing coercive control. But now to come to sort of the sort of crux and focus of this particular project and why we felt that it was important to look at that moment of identification in more detail in policing responses. So the first sort of issue relates to policing. So there's a persistent, powerful presence of positive policing in the context of policing domestic abuse. And positive policing is really called different things globally, but it largely emerges from mandatory arrest policies that emerged in particular in prominence in the US. So this idea that when police respond to a domestic abuse case, there is an expectation to do something. But it's also worth noting that Larry Sherman and the team who sort of developed the research informing those mandatory arrest policies have since themselves highlighted issues with the policies emerging from that research, i.e. the idea of mandatory arrests. But this continues to be the approach that's largely dominates globally. But in the UK, it is now recognised that positive policing doesn't necessarily have to relate to an arrest, but there is still that expectation to sort of do something in the policing response to domestic abuse. But actually, there's been quite little work exploring what positive policing actually means and for whom. So there's been an increasing amount of work looking at police officer effects in coercive control cases, for instance, with the recent work of Andy Myhill, Catherine Hole and Kelly Johnson being particularly significant there. But there is still space to do some more exploring around what this idea of positive policing means in more detail. And we start to try and unpack some of this as part of this project. But also in terms of thinking about that process of identifying the victim and perpetrator in coercive control cases, it's also important to think about that sort of ongoing tension between incident and process. Because in coercive and controlling behaviour cases, physical evidence may not always be evident. And so that identification of the victim and perpetrator can often be reliant on the testimony of those present. So it's often sort of said to be, oh, it's one word against the other. So again, how that feeds into that identification moment is important to explore. But then also embedded in some of this are victim, survivor and perpetrator issues. So the kind of frontline policing response has been highlighted to lead to issues such as dual arrests, so where both parties are arrested. And Julia Tolmie has particularly highlighted the potential for this in coercive control cases where there might be that ambiguity present as to what's happened in the moment when the police arrive, for instance. We're also seeing increasing evidence globally of systems abuse or manipulation of the system by perpetrators, which I'll come back to a little bit later on. And we're also seeing the increasing presence and knowledge of the existence of the misidentification of the primary victim and perpetrator, which has been particularly highlighted as an issue in Australia, as flagged by Ellen Reeves's work, with Indigenous and minoritised women in particular being more likely to be subjected to be misidentified as the primary perpetrator. So together we wanted to look at how some of these issues were emerging in England and Wales in greater detail. So to begin with then, in sort of digging into some of our findings, I want to first turn to the victim survivor perspective to begin with. So as I mentioned, as part of this project, we interviewed victim survivors about that kind of identification process in coercive control cases. And of course, pseudonyms have been provided for all here. And it was clear from the perspective of the victim survivors that we spoke with that there were some complexities in that identification process. And in the words of some of the victim survivors that we spoke with, some issues with them being labelled or identified or sort of seen as a true victim during the policing response. And sort of the three quotes on the slide here capture some of this. So you've got this one here, I won't read all of it, but the quote from Lucy saying, I think because from the off I didn't act like your typical victim, they didn't necessarily see me that way. And she kind of flags there that I was either hysterical because I didn't call them and I was terrified of what he might do, or I was angry because he'd actually called them on me when he is the one that had been violent. And then we've got the other quotes there on the slide by Angie. And again, I won't read the whole thing, but just to say that, just to note that she said that the police had been out a few times and there was drink in the mix. And I think because they saw us as both as pains in the arses and that we were both as bad as each other, but it wasn't that. And she goes on to kind of highlight that, you know, sometimes she did fight back, but that didn't mean that she wasn't the victim of his violence. And again, talking about that image of what a victim should look like. And there's similar sentiments there on the quote on the slide from Rachel, highlighting that I think the type of person I am meant that the police never really saw what I was going through as coercive control. I think they thought we were both as bad as each other. So we can see from the experiences from the women here that perhaps they felt that there were some issues with being seen as a true victim of coercive control and their experiences not being recognised in that way, either because that they didn't act according to those conceptions of what an ideal victim is, or perhaps because they fought back. And I'll come back to some of that in a moment. So just to summarise some of the themes emerging from the victim survivor interviews, including the three quotes there. So those women on the slide before, but also others alike, clearly felt that they were not necessarily seen as that true victim of coercive control by the police, highlighting that those conceptions around ideal victimhood may be informing police decisions around who is the victim and perpetrator in coercive control cases, at least to some extent. And this took different forms for the different victim survivors that we spoke with. So for some, this centred on the way that they felt that they presented themselves during the frontline response, which then influenced the policing response, so that they were either seen to be too hysterical, too angry, or too quiet. And perhaps because they did fight back, as noted, so they weren't necessarily seen as sort of passive victims. So all of this meant that for many of the women that we spoke with, they felt that they were constantly teetering on the edge of victimhood or being seen as a perpetrator in the eyes of the police, or at the very least that they were seen as being as bad as each other, or it was an argument rather than it being this sort of wider pattern of coercive control. And of course, we know that there's no set way the victim survivors respond in domestic abuse cases, or no set way for the police to react. And actually, for many of the victims that we spoke with, calling the police was a last resort, and they were understandably very concerned about the implications of what that might lead to. Or in many cases, actually, it wasn't them themselves that called the police. It was a neighbour, or it was perhaps a perpetrator engaging in a counter allegation. So that meant that for some of the victim survivors, that police presence was unexpected and uninvited. So perhaps that sort of hysterical or quiet response is really to be expected. The second issue to note is the ways in which perpetrators used allegations of mental ill health as a weapon against victim survivors. So, for instance, the women that we spoke with talked about perpetrators saying, oh, she was going nuts, so I called the police, or she's crazy, she doesn't know what she's talking about. And of course, the victim survivors that we spoke with themselves flagged, and actually, I was acting hysterical, or I was acting crazy in front of the police. And that's sort of, you know, that recognition that actually that was probably feeding into that narrative that the perpetrator was creating. And the perpetrators were, of course, aware of this. So 2 of the victims that we spoke with said that once the police had left, that the perpetrators were sort of hysterically, you know, laughing at the fact that, oh, no one will ever believe you now because you're seen as this as this sort of crazy woman. And also, alcohol was a reoccurring theme in many of the interviews with victim survivors. And this was either for one party or for both parties, where it was suggested that the presence of alcohol often meant that the police were perhaps more likely to perceive parties to both be as bad as each other. So it maybe be a drunken argument. And victim survivors sometimes felt that in those circumstances, the signs for coercive control perhaps weren't being looked at in quite the same way. And that again sort of, you know, feeds into narratives around ideal victimhood. And there are also kind of examples there around perpetrators using the system being a sort of a common theme across the victim survivor interviews. So, for instance, via counter allegations, with perpetrators being the one to call the police on victim survivors, for example, particularly if there'd been incidents of fighting back or self-defence. And as one of the survivors that we spoke with pointed out, you know, perpetrators are often very manipulative people, able to manipulate those around them, including the police. So that awareness of systems abuse is really important. But as Sandra's going to move on to talk about now, some of these issues were really interestingly acknowledged and flagged by the police officers that we spoke with, which is a real sort of development in the kind of body of our overall work of coercive control over the last number of years. So I'm going to hand over to Sandra now, who will talk about some of those things in more detail.
Thank you, Charlotte. Hello, everybody. Yeah, this is been a really interesting project, I think, in an interesting moment with with our partner police force, in terms of what we've been able to capture, I think, in terms of the police's own journey in learning about coercive control since the introduction of the offence in 2015. And part of that learning came out of the case file analysis stage of the project, in which we actually, Emma, did a lot of digging around 58 cases, looking at what we could discern from that case file analysis from the moment at which an incident was reported to the police to its final outcome. And from these 58 cases were chosen at random, and there were a mix of where arrest took place and where arrest didn't take place. But what was striking to us is that out of those 58 cases, 55 of them included some positive action by the police. And that positive action could be the suspect being charged, could have been the suspect being placed in custody, but also, interestingly, could have included a fairly wide range of other actions: non-molestation orders, changing the locks, putting a vulnerable DV marker on addresses so that other colleagues would know that there was an issue there, installing panic alarms, referrals to independent domestic violence advisors, health services, education services where children were present. Excuse me. So notably, actually, we're not talking about one-off responses in one-off cases. We're actually talking about a mixture of responses from these frontline officers. So in 43 cases, more than one type of positive action was put into place. And I think that is a really, really interesting observation, including when the victim survivors didn't want to pursue a prosecution. So they would introduce options such as applying for a restraining order or a protection order. Other sorts of more civil-oriented options were generated at that moment of response. So actually, what that data kind of suggested to us is that the frontline officer was prioritising safeguarding and positive action in cases of coercive control. And it's that theme of safeguarding that I think has often been lost in the positive policing story that Charlotte alluded to when we started. Okay, so when we actually began to interview police officers as a part of this project, so the case file analysis was done early on in the project process. 12 of our 13 interviewees talked about the relationship between safeguarding and positive action, and they talked about it in differently nuanced ways. So one respondent said, you know, coercive control is about engaging individually with both parties in separate rooms. We kind of work out what the options were and what our main interest being safeguarding at that point. Okay, so if someone is saying I'm being quite controlled, we think about what we can do. Is it about arrest or is it about something else? Is it about making sure that person is safe? And that came across strongly in a lot of our participants' responses, knowing that, you know, many of the victim survivors they were dealing with, as Charlotte has very articulately pointed out, didn't want the police there in the first place. So it's a kind of sensitive process of negotiation. And as our second respondent said, quite upfront, the priority is safeguarding. This usually means separating the parties, making sure the kids are safe if they're only in the house. We'll signpost the victim to other services. Maybe we can allocate an IDFA. And then in coercive controlling cases, often we ask the suspect to come in for a voluntary interview because there isn't always at that point the evidence to arrest. So it's much more about safeguarding. And we hear all those domestic homicide review cases where proper safeguarding hasn't been put in place. So, you know, you're still getting that sense it's important to cover ourselves, really, but also it's important to really keep everyone safe. And that theme of safeguarding, I think, is a really important one in moving the focus of our attention a little away from the arrest, non-arrest, and thinking more holistically about what's actually going on at that moment of identification. Okay. So in listening to police officers a little bit more and asking them a little bit more about what that means to them in the context of coercive control cases, we were very much aware of the tensions that Charlotte has alluded to between incident and process. You know, the ongoing problem of coercive control legislation is in its implementation is how do you capture process when you actually are responding to an incident? And again, 12 of our officers interviewed talked about digging deeper, the importance of looking beyond the immediate incident to get a sense of the wider context. And actually, all the victim survivors we interviewed also talked about the importance of that. So participant 1, for example, talked about the importance of digging deeper, especially in relation to counter allegations made by the perpetrator. He said, I often look at it like with counter allegations because perpetrators are very manipulative, very manipulative people, and they'll ring and they'll come across as the innocent party. And it's about being wise to that, and obviously make sure that you're checking out what they're saying is actually accurate. But it can also be complicated, as another respondent said. It's about seeing the bigger picture. You can dig in a case and see family court involvement, for example. Then all of a sudden the clouds part and like, there's other stuff going on here. And it's the realization that perpetrators manipulate other agencies as well. Whilst there isn't always the time to do that digging, as this officer acknowledged, I'm not sure they've got a complete grip on that, but at least there's a recognition there. And there's an important recognition of perpetrators' capacity for manipulation, which again came out of our victim survivor interviews. And sometimes digging deeper can reveal what the victim survivor is experiencing, even though they haven't recognised those experiences as problematic. As one officer said, to be honest, tends not that we're going to coercive control cases, but it comes out when we do risk assessment questions. And once you start digging a bit deeper and start asking questions, and this officer was actually referring to questions above and beyond those that are in the risk assessment schedule, is that they don't usually realise that they are being controlled. They don't usually realise that that's what's going on for them. So sometimes it's that interaction becomes an educative moment, a light bulb moment for all parties concerned. So that theme came across very strongly to us from our interviews with police officers. And I think when we start to put the victim survivors' narratives alongside the police officers' narratives and alongside the case file analysis, it's quite clear that we're dealing here often with complex lives to which there are no simple solutions. You know, that's the classic trio that the psychologists often talk about in this field, about drugs, alcohol and mental health. That clearly is an ongoing issue, and David Gadd has written very thoughtfully about those sorts of complexities and how to respond to them. But what's coming out of both sets of interviews, initially from the victim survivors, but also clearly being alluded to in some of the policing interviews as well, are what we've started to call the 4 M's. Yes, manipulation, misunderstanding, miscommunication and misidentification. In other words, identifying who the victim is itself quite complicated. It isn't straightforwardly about misidentification. Sometimes it is, and there's an increasing recognition of this, of recognising the perpetrator's capacity for manipulation. Sometimes it is just misunderstanding, especially between perhaps a frontline officer and a victim survivor who doesn't fully understand why the actions are being taken that have been taken. And sometimes it's about miscommunication, and also misidentification can happen, but there's a process before you get there. And you know, looking more closely at that moment, I think reveals some of the complexities there, and also some of the opportunities for learning. So when we actually do put positive policing, as we've experienced it in this project, and the victim survivor voices all in the same, as I suggest there, all in the same critical plane, what are we learning? Ongoing power of stereotypes. The ideal victim is alive and well and informing policy responses at every level. There's no doubt about that, especially from the testimonies of our victim survivors. Greater awareness of coercive controlling behaviour and how it's being manifested, absolutely. You know, that's one of the big lessons for us from the very first project we did on coercive control, is how much more nuanced the police officers we've been talking to in the last 12 months, how much more nuanced their understanding is now of coercive controlling behaviour. Okay. Greater awareness of systems abuse, absolutely, absolutely, that comes clearly across from our data. As some kind of perhaps contextual caveat, it is important to understand the context of policy and practice. Our partner forces has been very helpful and has been very innovative across the years in its responses to domestic abuse. So we're not making any claims here that this can be translated across the board, but we are suggesting that that there is space for both our understanding as academics and practitioner understandings of what this process actually looks like. The importance of the policing journey, absolutely. I don't think we could say that more strongly, of actually understanding that, you know, policing responses in and around this issue have changed quite significantly in the police forces we've worked with over the last 8 years. The importance of thinking holistically, absolutely. Thinking about women's lives as holistically, but thinking about their experiences of being responded to in relation to criminal justice professionals holistically as well, not just looking at the one point of were they arrested or not, but actually for us as researchers to look more closely at what that engagement has actually looked like and where there is opportunities for different kinds of intervention, and perhaps understanding police officers' conceptions of safeguarding in a little more nuanced way. So as a kind of being slightly more academic now, I suppose, if I haven't been already, some general concluding thoughts. The importance of time, you know, change doesn't happen overnight. And I think those who expect the criminal justice or expect the law to change things perhaps are overambitious in their expectations. Change doesn't happen overnight, but it can and does change slowly, incrementally, and with resources and commitment. Which kind of, I think, for me personally, and I think maybe I persuaded Charlotte on this one, but the need to unpack the black box of positive policing a little more carefully. And I'm using the term black box in the sense of Latour's work, you know, of what's assumed by positive policing. Let's just unpack it a bit more carefully, and let's have a bit more of a nuanced understanding and debate around what that looks like. And if we do that, it also implies that we need to reflect much more carefully on what Lee Goodmark has called exporting without a license. Now, she does actually use that phrase in relation to mandatory policing policies that have travelled across the world since the early 1980s to a wide range of jurisdictions, which even by 1992, the researchers themselves were saying, this doesn't work for everybody in every place, but nobody seems to want to listen to that. They just kind of want to go, oh no, this is what we do. Well, it isn't what we do. We need to think a bit more carefully about what I've called their conceptual exporting without a license, which goes back to our focus on, clearly when we started, we were interested in this rising debate about misidentification, and hopefully what our data has shown in the particular context in which we were working is that misidentification is complicated and it's mixed up with miscommunication, misinformation, and you know, people's pretty messy lives. Doesn't mean to say it doesn't happen. We're just trying to suggest that it has a powerful presence in one jurisdiction that might not travel quite so well into other jurisdictions. And basically, you know, I think the strong message from our victim survivors' voices in this project is the ongoing complexities of living with violences. And if any of you read our report, we're very careful to say that the stories they're telling us are experienced and retold holistically not as bits and pieces where you have one policy that deals with that bit and another policy that deals with that bit. So, for example, their experiences of coercive control might include economic issues, might include being separated from their friends, might include having trackers in their car on their mobile phone. These are not separate and separable issues. So I think that's a real challenge to siloed thinking that is really beginning to emerge around coercive control, so that we talk about the economic and the digital as these are separate and separable issues. The women's stories that we listened to didn't separate those things out. They were all part and parcel of their real lives. And I think that's us done. Thank you for listening, everybody.
Brilliant. Thanks ever so much, Sandra and Charlotte. So we're now onto the Q&A section. I don't think there's any questions in the chat. Oh, hang on. No, there's no questions in the chat at the moment. So I'll just get us started, and then if people can just raise their hand when you want to ask a question, I'll call on you. So that'd be helpful. Thank you. Yes, I was thinking, you know, when you were talking about the initial responses of the police and this recurring phrase of being told or perceiving the police to judge you as being both as bad as each other. And I was thinking about like the complexity of that in like the real world situation where, you know, I can well understand that it seems like a common sense judgment. It seems like actually what we often ask police to do, which is to do less, to say, OK, this isn't something where we need to get involved. We can just kind of calm down the situation and let people sort this out themselves. You know, having an approach where it's like it's always assumed that it is coercive control, and that also doesn't seem like necessarily a great starting point. And I was wondering if when you were talking about digging deeper and like looking for the other context around it, kind of what metric you think the police should be using to kind of make that judgment call, or if you think it should just be from a standing start that you never think people are as bad as each other, like that's just taken off the table as an option, or if there could be like a metric, like almost like a checklist that people can that police could run through to be like, OK, this is my vibe, but let's check that against, you know, ABC, and sort of see where that gets us. So I just wanted your take on that.
Thanks for that, Helen. Sandra, do you have a thought on that, or me go first? You go first, whoever.
Just my immediate response is that I don't think certainly the police officers that I personally interviewed didn't need a checklist. They were doing that anyway. It was in their heads, you know, and that was the kind of the orientation that they had in responding to the incidents that were called out. Yeah, sometimes, yeah, you know, I guess, I suppose, the prompt to go through their own internal checklist was kind of intuitive. Certainly, there would be key factors where, you know, the presence of children, especially if children were present and both parties were also clearly under the influence of alcohol, for example, would provoke them to look a bit further at what was going on here. Again, putting the interests of the child to the forefront. But I don't know. I've got a kind of gut feeling that checklists aren't what we need to do here. It's about acknowledging that the police officers themselves that we spoke to, for the most part, can use their professional judgment and kind of just work through, okay, this is my sense of what might be going on here. Let's have a look at that a bit more closely. If there's any gap in that, it's actually communicating that more effectively to the victim survivor, I think, in terms of that's the process that they're going through. Charlotte may have different views on that.
Yeah, no, I do have the same view, but just as a point to add, I think that the reality is that during that sort of initial frontline response, where there is, you know, incredibly stretched resource, you know, the kind of phones going off for the next sort of response and so on and so forth. The reality is that coercive control is so complex that you may not have everything that you need in that moment to sort of make those decisions. And also, of course, many coercive control cases might not get that blue flashing light response, because the reality is that it's, you know, it might be a scheduled call, for instance, that's some days after the initial call. So I suppose the key, what I think we would also take from it, is kind of linked to what Sandra was just saying there, is sort of in that sort of first moment, it's about listening, truly listening to sort of what's going on, sort of, you know, making sure that the safeguarding's in place, communication being key in that moment there as well, and sort of, you know, recognition that all of the answers aren't going to be in that moment, but just making sure that, you know, that there is that sort of, you know, listening, communicative, sort of centered approach during that sort of first initial response, because it's incredibly powerful, that first response. It can make a big difference. So that's the only other thing that I would add.
And maybe then that kind of internal checklist, that if maybe externalizing that would be a good communication tool, you know, something to consider. So then we've got Jeff has his hand up, and then there's a question in the chat that I'll come to.
Hi, thanks for the presentation. I really enjoyed it. Great bit of research from what the presentation set out. I was wondering if you could just say a little bit more about positive policing. And is this the same as positive action? So when we did research on response officers turning up domestic abuse cases, positive action was, the expectation of positive action was talked about in terms of what you actually did at the scene, rather than what you did afterwards. And so you were talking about things like civil orders, for example, which I wouldn't have sort of included under positive action. And also whether there was any confusion amongst officers in terms of whether positive action or positive policing was the same as mandatory arrest, because that was something which we found a lot of officers were confused by, and obviously mandatory arrest isn't something we can do in this country lawfully.
Thanks for that, Jeff. Sandra, do you want to go first, or me? I just never like to just jump in and assume.
No, I don't. You pick it up, Charlotte, but I didn't pick up any confusion of anything, any of the actions they were engaging with in relation to mandatory arrest. That didn't come up in any of the interviews I did at all. Go on, Charlotte.
Yeah, no, similar, but I think the point you make there around sort of positive action and positive policing is a really interesting one, and something I think that's sort of what Sandra was alluding to there around the black box issue, around actually what do we mean here in terms of the conflation of those two things. And I think that what was clear from sort of the interviews that we conducted is that positive policing more broadly is this sort of, I guess, overall approach to safeguarding. And what does that mean? So it isn't just necessarily the positive actions that happen in that first frontline response, but things like making sure an IDVA is available, kind of also making sure that the things that come after are sort of part of that process. So I think that's very much something that we're planning on, you know, unpicking a little bit more with this work in terms of where do those two things start and end. But it'd be interesting to chat with you more about that, Jeff, if that's something that you sort of found as well in that. So thank you for that question.
Very, very quickly, it was something we found a few years ago, and things changed. So I mean, it sounds quite that things are moving in a positive direction. Thanks for clarifying that. It's great.
That's really interesting. Yeah, good to see. that change. So then we've got a question from Byron Wiltshire in the chat. Byron, would you like to come on camera? And yeah, there we go.
Hi. It wasn't more of a question, but obviously we see CCB arrive in domestic homicide reviews, and often they're non-crime. And I think the thing is, we officers know the term. They know the term, and they know what it loosely means. The problems come is the when you get into break down into the nuances, and that's when the understanding is lost. And also our crime recording. So if there's other priority offences, so if we've got a serious assault, that might go as the primary. So you won't get the CCB then appear unless it's in the detail. So then you don't get correct data of how many CCB cases there are. I know that's changing. We're looking to record CCB as the main primary offence from now on, so you can get that. But yeah, it's the continuous professional development, the financial, the economic, that's the lack of understanding. And I think we've really come a long way in understanding controlling coercive behaviour. And we did adopt DA matters, and we did that, but you'll find those 6,000 officers that were trained no longer sit in those posts, no longer sitting within public protection, have moved on. So then you know, it's almost like you're continuously playing catch up with it. So they know the term, which is great. They know positive action, which is brilliant. We've adopted DARA, which is supposed to draw out more coercive control. So we'll see how that plays out. But I do feel it's the real, when it crosses over into honour-based abuse as well, when it crosses over into harassment, and they put harassment as opposed to stalking, you know, so I mean, this is obviously really helpful, really interesting, you know, from the policing perspective, but certainly as London, as a agency, we've got 55 commands that were all broken down. Each business area, I think, has something to play, not just public protection, but we will all focus on public protection and our domestic abuse officers, but actually it's your robbery team that might be arresting that robber, that might actually be coercively controlling that victim. And that's where it gets lost. And I think that's, for me, it's that. But this is really helpful, and I'm going to be sharing it with our professional standards commands for the police perpetrated element, which is massively missed for the officer involved domestic abuse as well, and different perpetrator tactics are used around CCB. So really interesting, but it was just more those observations, and I think this will help, you know, definitely sort of reinforce that message across our organisation.
Yeah, thank you, Byron. And I think what you've just said there is really rings true from sort of the range of projects that we've done, you know, in terms of, you know, how long it can take for that understanding to start moving, and the resource, as Sandra mentioned in the presentation, that's needed to sort of make sure that that kind of learning and knowledge continues to develop. And I think in particular what was interesting from this project is that it is clear that those conceptions around ideal victims, or a typical victim of coercive control, and what that might look like, and when you start adding these complexities into the mix, that can sometimes be where that understanding of coercive control gets lost, particularly when there is those repeat victims, which we know is very common in domestic abuse, and, you know, there's sometimes the persistent attitudes sort of towards that. I think that's where some of those complexities in particular are really prevalent. So yeah, it's just to say, yeah, very much agree with what you've just said.
Thank you. Yes, and great to hear that it's going to be shared in your jurisdiction as well. That's good impact. And yes, yeah, that's what I wanted to draw your attention to. We had another webinar a couple of weeks ago led by Barry Godfrey. Sandra was also involved in that project, about managing high frequency, high harm perpetrators, and how coming back to what you're saying about this crossover, and how you know, a huge amount of resource, police resource, actually is focused on quite a small group of people who have these repeat patterns of behaviour, and that tend to go across domestic abuse and other forms of activity as well, such as theft and so forth. So you might want to check that out as well. the recording is on our website, and I'll share that with everyone afterwards when I share this as well. We've got 2 more questions, I think, or possibly 3. So we'll do those quickly, and then it's probably time to wrap up. So Leonie, I think you. Oh no, sorry. Yeah, no, it is Leonie is the next question. About having more than one who attends the scene, who does that frontline attendance. Leonie, are you still online? Would you like to come on and ask your question? No problem if not. Oh, there you are. Hello.
Hi, yeah. So my question was, obviously I'm sure that you're all aware, but in more recent years, and especially obviously after COVID, mental health crisis has massively become something that the police themselves have had to be the first people to go and attend to. And obviously it's kind of been looked at and it's been reviewed in terms of how that can be better done in order for it to obviously be better handled within the criminal justice system. So what they've done is they've implemented what's known as street triage, and obviously like a mental health car, if you will, because what you've got is somebody who is sort of specialising within that area and kind of trained and has access to more information to assist the police when attending a particular sort of crisis moment. So I kind of wonder, could the same perhaps be replicated in terms of those first initial responses when attending something that's believed to be a DV related incident? Where, so say for instance in IDVA, obviously you have IDVAs in house, and so I'm actually situated in a police station, and obviously the IDVAs are upstairs for us. So whenever we've been to see somebody in custody, and we're aware of certain things, we go and speak to them, and it's so advantageous because of all of the extra information that they have that is not attached to that one particular case. So for that alone, and I appreciate, you know, resources at the moment and services are incredibly saturated, but would it perhaps be beneficial to kind of look at almost in a way mirroring what's currently being done for the mental health in terms of implementing that mental health car, perhaps doing that in terms of DV? Because as I'm sure we're aware, especially since COVID, domestic cases have significantly risen, as I really don't need to preach to you. So I kind of think, is that perhaps a way forward in terms of not just making it so that the police are the first responders and it being reliant on police officers to have all of this knowledge, have all of this training and try and handle it in, you know, a way that looking at it in hindsight could have been handled better, but actually equipping them with a second person who is specifically trained and has more additional knowledge? Is that perhaps a little bit of a way to sort of go about it perhaps in the future maybe?
Yes.
So I was going to say that there was actually some work done on an initiative exactly like that, and I think I'm right in remembering it was with our partner force, where they sent an IDVA out with every. This was during COVID. It was a kind of they sent an IDVA out with every police officer to every domestic incident. That has been reported on. There is a publication available from that. The name of the author escapes me right now, so if they're on the call, I apologise, but I do know that they published from it. I don't know what happened to the initiative, but I suspect, and this is my very personal view, it turned out to be too resource costly, as it would do, because, you know, police force areas and the funding of IDVAs is a fairly complex puzzle. You know, so, you know, some police force areas cover 5 local authorities, and often it's the local authority who funds IDVAs, and they're not all necessarily funded in the same way. And that's
constantly issued out as a 12-month contract, aren't they? At the moment, it's 24 months issued out, and it's never on a permanent basis, is it?
Yeah. If you email me, Leonie, I'll dig out the paper for you that does actually did actually kind of assess the efficacy of that particular experiment during COVID. But yeah,
it'd be a travesty if it was just down to the cost as to why it was made redundant, though, isn't it?
It is. I don't know. I'm just guessing, but I mean, Charlotte may know more than me.
No, nothing more to add. I was going to say the same thing. So yeah, really interesting points. And yeah, Sandra can do some digging on finding the paper.
Okay.
Well,
thank
it'd
you.
be rude to jump in, but just on the back of what Leona's saying, Blackpool actually still have that running where they have an IDVA 24/7 going out with the police. And I'm over in Wigan, and the Wigan police over here are just piloting that now. So an IDVA will go out to every domestic abuse call with a police officer, and it's just a pilot at the moment. They've just got some funding, so the trial. It's on. I'm sorry I jumped in there, but I just felt it was relevant of what Leonie was saying, that it is out there. Like I said, I do know Blackpool have it, somebody based in the police station 24/7, and they do go out with the police. And like I said, we're going to just piloting it now.
That's
Sorry
brilliant.
for jumping in.
That's brilliant.
That's incredibly relevant. Thank you, Bridget. That's really useful to hear. And it'd be really interesting to see some research on, maybe comparing the different pilots and seeing like how to make it work consistently. When you say someone's there 24/7, hopefully it's more than one person. Like take
Round the clock. I think we've got about 6.
It's one person. I'm just going to. There's a question from Angela Ramage, and I think actually, Bridget, that was your hand that was it, wasn't it? And then and then one from Carly Lightowlers as well. If you'll forgive me, Angela, I'm just going to pose yours just to save a little time. You were asking about if the research found any crossover between coercive control and stalking, and because some of the behaviours are similar in terms of surveillance and monitoring, and wondering if the issue came up and if there was confusion from police about which charge or intervention to pursue.
Yeah, so hi Angela, by the way. Angela's a PhD student at UCLan, so hi Angela. It's basically in this project it wasn't something that emerged as much in this particular project, but in other projects that we've done on coercive control and other forces earlier, in the criminalisation of coercive control, there was a little bit more confusion, I would say, around that. That's not to say that it still won't exist, but I think that it was perhaps more of an issue early doors. But as was sort of mentioned in the some of the discussions, then obviously it's been in place for sort of 8 years. There's more of an understanding of where some behaviours kind of where some behaviours sit, although there's still some crossover there, of course, so not as prominent, I would say.
Great. Okay, good. That's interesting. I imagine you'll have something interesting to say about that with your research, Angela. And Andrew, if you're a PhD student, please do look at joining the NRIPN, our New Researchers in Policing Network, and there are opportunities to share your research and develop it as well. So the final question from Carly. Hi Carly, I'll do the same here too. Carly, I know there's a lot of research on like the role of alcohol in domestic abuse, especially like the difference between public-private drinking, and there's victims might be drinking to cope with their victimization compared to the emboldened perpetration by the other party owing to consumption. So 2 different patterns of drinking there. Did this come out in the qualitative data at all? Is it something that you'd be interested in looking into further? Like, would that possibly be a like helpful avenue to maybe for helping police to sort of say, like, just that there is a potential difference between someone drinking to cope and someone drinking and then that fueling the situation. And of course you can't really probably can't make a fine distinction between those 2 things.
Yeah, no, well, I know Sandra's probably, I'll just say something super quick, which was that it wasn't something that we delved into in lots of detail. It was more, we didn't ask a question specifically related to alcohol. It just so happened that alcohol was a sort of a theme that sort of came out of all of the interviews. In sort of a passing comments, it was alluded to by victim survivors that, you know, perhaps in some instances it was, you know, to drink either because that, you know, the perpetrator drank and so he wanted her to drink as well, or as a coping mechanism, but it wasn't the sort of focus. But I do, however, think that's really interesting as an area, but it wasn't something that necessarily came out in the qualitative data. I don't know whether you've got anything to add to that, Sandra, or...
No, that would be my reading of what our findings say too. Yeah, interesting observation, but not something that was directly came out of the people we talked to.
And I see you've got a cold, Carly, so I hope you're okay. Comments.
Seeing there's just a question from Georgiana there about recruiting police. Georgiana, if you can also join the NRIPN and send me an email, and I can give you some like support with that. So just to wrap up, we are slightly over 8 minutes, but it has been very interesting, and thank you for all the interesting questions as well. I just wanted to ask Charlotte and Sandra to tell us what's next with the research and how it's being developed. So any publications that you've got coming out. Obviously we've got the gender-based violence conference, so if you want to.
You want to take it, or shall I, Sandra?
Well, just to say that we are going to we're doing a presentation to our partner police force next week. So that's the next stage, if you like, in where this work's taken us. We have a conference presentation at the Australia New Zealand Criminology Conference that, based on this research, that I'll be presenting in December. But we do have two specific papers that we think would make sense from this particular work, and a third piece of work which is kind of telling our policing story over the last 8 years, as it were, reflecting on where this particular learning about policing coercive control has developed and what shape and form it has now. So at least 3 little bits. One of which takes us back to an earlier N8 funded project.
Yes, no, that sounds absolutely fascinating, and we'd be obviously great to hear more about that. Have you seen any changes in the way that the partner force has dealt with this issue due to your research, or have you what kind of impact activity are you taking part in at the moment? Possibly more widely on on a sort of national policy level.
I think a lot of this will come after the presentation next week. So we're still, this is sort of the first sort of dissemination, I suppose, of the project, with it coming next week. So we really are, as part of that plan, are going to sort of work closely with the force, but also kind of obviously, you know, to disseminate more widely with other N8 forces and beyond, of course, ways that we can do this. And we've that's always been a kind of key part of the way that we've worked on this coercive control work, is making sure that we sort of support relevant agencies in relation to practice. So our plan is very much to continue that same trajectory of doing the same approach. So
that's brilliant. Okay, that's great. Okay, so if you want to hear more about the project, then please do get in touch with Charlotte or Sandra. Their email addresses are on the NRIPN website on the report page, which I will quickly share with you. And that also has the report, and that's going to be where I'll put the link to the recording from today as well. There we go, that's the link. I'll just stop recording.